The authors do not have any financial interest in the subject matter of this video. Tosh Pro Medical presents EyeLight, a revolution in dry eye therapy. The prevalence of dry eye is rampantly increasing all over the world. It has multiple etiologies, meibomian gland dysfunction being one of the commonest causes of evaporative dry eye. The current treatment modalities of dry eye are not good enough. What new treatment options do we have then for evaporative dry eye? Introducing intense pulse light therapy, a novel approach to treating intractable dry eye. Let us first take a glance at the etiology of MGD. Eyelid temperature influences the physical properties of the meibum. At room temperature, the temperature at the eyelids is 33 degrees Celsius. The physical properties of the meibum is altered in MGD, causing a functional block. Next, the abnormal telangiectatic blood vessels seen on the eyelids of MGD patients secrete inflammatory cytokines that trigger inflammation and dysfunction of the meibomian glands. Also, there is accumulation of the dead epithelial cells on the lid margins that clog the orifices of the meibomian glands. Pain is the most common and annoying symptom for dry eye patients. But what drives this pain in dry eye? First is the pro-nociceptive cytokines in the tear fluid levels, low levels of vitamin D, and high corneal dendritic cell density. Normally, the anti-nociceptive factors are responsible in preventing this pain, but in case of an imbalance between the pro and anti-nociceptive factors, there is activation of the pain-mediating channels, which results in depolarization of neurons and results in exaggerated nociception. So what's the latest treatment of dry eye? It's the intense pulse light therapy. What are its mechanisms of action? IPL increases the eyelid temperature to 80 to 90 degrees Celsius in the larger vessels and 45 to 70 degrees in smaller vessels, which liquefies the altered meibum, facilitating its excretion. It thus relieves the functional blockage of the meibomian glands and restores its function, giving symptomatic relief to these patients. It also destroys the abnormal erythematous blood vessels, thus reducing the inflammatory mediators and making the ocular surface healthier.